We're diving deep into another crucial immunohistochemistry test, the IgA polyclonal test. This test plays a vital role in diagnosing certain skin and renal diseases by detecting the presence of immunoglobulin A, or IgA. So, let's get started. Introduction to IgA polyclonal test. The IgA polyclonal test is a specialized test in immunohistochemistry used to detect IgA deposits in tissue samples. IgA, or immunoglobulin A, is an antibody that is crucial in the immune response, particularly in areas such as the gastrointestinal tract and respiratory pathways. Understanding this test can provide valuable insights into certain medical conditions. Pre-test information. Before we discuss the specifics of the IgA polyclonal test, there are a few key pieces of pre-test information that are crucial for accurate diagnosis and effective treatment planning. Histopathology report. It is essential to provide a copy of the histopathology report. This report gives a detailed examination of the tissue sample, providing valuable context for interpreting the immunohistochemistry results. Site of biopsy. Knowing the exact site of the biopsy is vital. The location can influence the interpretation of the results, especially when assessing for localized or systemic conditions. Clinical history. A comprehensive clinical history of the patient is necessary. This includes any symptoms, previous medical conditions, and relevant family history, which helps in correlating the test findings with clinical features. Specification of the IgA polyclonal test. Now let's discuss the specifications of the IgA polyclonal test. This test is designed to detect IgA deposits in tissue samples, which helps in identifying specific immune responses in various diseases. Diseases associated with the IgA polyclonal test. The IgA polyclonal test is primarily associated with detecting and diagnosing diseases such as Immunobullous disorders of the skin. These are a group of rare skin conditions that involve the immune system attacking the skin, leading to blister formation. Medical renal diseases. Conditions such as IgA nephropathy, also known as Buerger's disease, are characterized by IgA deposits in the kidneys, leading to inflammation and potential kidney damage over time. Specimen used for the test. The specimen typically used for this test is a biopsy sample. Depending on the suspected condition, this could be a skin biopsy or a renal biopsy. The choice of specimen is critical for accurate localization and detection of IgA deposits. Components included in the IgA polyclonal test. The components of the IgA polyclonal test include polyclonal IgA antibodies. These are used to detect IgA deposits in the tissue samples. Tissue sections. Prepared from the biopsy specimens to be examined under a microscope. Fluorescent or chromogenic markers. These markers help visualize the presence of IgA in the tissue. Test report time. One important detail to keep in mind is the test report time. The IgA polyclonal test generally takes about 7 days to process. This time frame allows for proper preparation, staining, and analysis of the biopsy samples. General test information. Let's wrap up with some general information about the IgA polyclonal test. This test is often used in conjunction with IgG testing in both renal and skin biopsies. The combination helps to localize and identify specific immunoglobulin deposits, which is crucial for diagnosing immunobullous disorders of the skin and various medical renal diseases.